Another mass shooting in the United States, this time in San Bernardino, California, 16 dead, including the shooters. It's the deadliest shooting in the United States since the massacre at Sandy Hook in 2012. And while it seems these incidents are becoming commonplace, the images and the video we see are no less frightening to all of us. And for children, the images can be especially terrifying and in some cases even confusing. Why would someone do this? Could this happen to me or mom and dad? Today I'm joined by Dr. Jim O'Day, Vice President of Operations for the Hartford Healthcare Behavioral Health Network. Dr. O'Day, how do we explain, is it possible to explain these events to young children?
Steve, first off, I think it's an important topic. It's important that we come together and use it as an opportunity to educate our community and talk with parents about what is a good way for them to approach it, because many parents have questions about how to handle this situation that's happening right now.
Is there a limit to what kids should be watching on TV? Do we need to monitor their viewing of the news?
Yeah, I think it's very important actually that we take what I would describe as a developmental approach to an understanding here. That we can't think of children as just children. Children are at different age ranges and children at different ages and developmental stages have different capacities to deal with this information. I would say first and foremost, especially for very young children, there's no reason for them to be aware even that this is going on. We should very much as we can, insulate our children from exposure to these kind of traumatic images and the kind of conversations that are happening in the news cycle right now.
I know we talked a little bit about the age differences, but as kids get older, they want to know why these things are happening. And if a child is maybe approaching their teen years, how do you explain this to them if they ask, why do people do this?
Well, again, the first thing I'm going to say is we need to listen first more than talk, because the kids are having reactions to this and we need to listen to the things that they're telling us. I was in the car last night with my 13-year-old, and my 13-year-old asked me a question in response to the things that had been talked about at school that day. And he said to me, "Dad, how far away is California?" Now, my 13-year-old has been to California. He knows that California is about 3,000 miles away from here, but really what he's asking me in that question is something like that going to happen in our community? Am I safe? Are we safe? And so the first thing that I can do is not answer the question, it's about 3,000 miles away. The thing that I really needed to say is that these are very, very rare events. And just because they're on the news, they can give the impression that it's happening all the time. These are exceedingly rare events. They're not likely to happen in any of our communities, and we need to reassure our children that they are safe and that there are a whole collection of people that are working very hard to continue to keep us safe. Our local law enforcement, our school districts, our community leaders, that the vast majority of our communities are very, very safe, and they're safe.
How about for mom and dad? As we try to explain these incidents to the children, they're still tough on us. Your advice to mom and dad as we take in these images and as we try to explain this to our children?
So I have a very consistent response to these kind of questions, Steve. I think it's very important that we all limit our screen time. You know, one of the things that I think happens in many of our families is the TV is on in the background. And people think they're not really paying attention, but when this is on the news cycle in the way that it is, and people are constantly seeing images, even if they're walking by an image or hearing conversation of how many people are deceased, how many people are injured, there's a level of trauma that happens just by witnessing this around the house. So I think it's very important that people limit exposure to traumatic images. It's important that they limit their exposure to listening to this all the time, thinking in some ways it's going to bind your anxiety. It doesn't bind your anxiety, and if anything, for some people, especially more vulnerable folks, it makes them more apprehensive about the world around them.